Despite the fact that these are becoming more popular, there are still defined benefits that sort of are accrued by the volunteers and the organizations that go. But the benefits for the community abroad are a little more mixed. It's not really sure exactly what they get. And so this is what we talk about in our organization as the balance of benefits, right? So literature documents that trainees get clear benefit. Can you guys think of maybe some benefits that you might get, or for those who've gone abroad, what were some of the benefits that you sort of experienced by going abroad?
Probably something like cultural competence.
Cultural competence, right? So understanding a different culture, understanding an experience outside of the country that's not your own. Sure.
Definitely a greater appreciation of the barriers to health in these nations.
Yes, so you go there and you see sort of, in terms of barriers to health, as well as sort of health conditions in limited resource settings where people may not necessarily have access to care. That's definitely another one. And related to that, you're actually also seeing a lot of trainees will be able to see disease entities and diseases that they may not necessarily have seen while they were training here in Canada or the United States. Anything else people can think of? How about for the sending organizations? Is there a benefit that they derive from going abroad, from doing work abroad? So one of the big things, right, in terms of what the sending organizations get is they get sort of an enhancement to their reputation. They're basically, and actually as a matter of fact, the reason you're seeing a lot of alternative spring break programs crop up, the reason you're seeing a lot more medical schools promoting global health experiences is because that has been shown through market surveys to be an attraction for prospective students. Prospective students look for opportunities to go abroad. And so if they're able to say, okay, look, we're doing good abroad, it doesn't matter how they do it or why they do it, it's actually a draw for students. It actually helps with their reputation, increased recognition, that sort of stuff. And then of course there's also increased partnership opportunities for the organizations. So they can partner, let's say if they want to do research in the developing world. If they have a local partner, it's easier for them. So there are clear benefits for the participants and trainees, clear benefits from organizations here. Now, for the participants' communities, there's also an indirect benefit. So meaning, for our community right here back in Canada, or like here in Hamilton, there is a benefit because it shows that trainees who go abroad are more likely to choose primary care specialties. They're more likely to choose to work with underserved populations. They're more likely to be quote-unquote altruistic or have an interest in being involved in community charity and advocacy. And that's all been well documented in sort of the elective experience literature that's been out there. So that said though, like I said, you have all these people that are benefiting. Us, we benefit. But for the local organizations and communities, the benefits are uncertain and there are definitely potential harms or defined harms that occur, right? So for example, in terms of clinical care, there's obviously a mild benefit short term, but like I said, going back to the idea of the placebo of global health, like what are you really doing? And then in general, these communities also invest quite a bit in having these volunteers, right? So they redirect a lot of their limited resources to host the people, to host visiting volunteers. There's very little system change that occurs, right? Basically, these single teams come down for a week or 2 weeks. There's these potential harms that arise because it's an unequal relationship. It uses their resources. These communities often will invest staff and time into these efforts, thinking that these relationships that they're developing are going to go somewhere. Maybe they'll gain something from it. Either they can gain professionally by being able to emigrate from their country or go abroad, etc. And then to add this all together with what we call the balance of the benefits, the thing that we had the biggest trouble reconciling is that volunteers who do go abroad, including ourselves, sort of feel like they're doing it because they want to do something. They want to do something good. They want to help, but they may not necessarily be helping. So this leads to the current thinking that is out there in terms of short-term medical trips. And in general, short-term medical trips are sort of viewed in two minds right now. You've got a bunch of people who think they're great, look at what I did, I was able to go abroad, humanity is wonderful. And then you have the other people who are like, short-term trips are absolutely horrible and they should never be done and we should just get out of the game altogether. A lot of the leading organizations are starting to sort of preach some value in short-term trips but have a guarded view regarding their overall benefit. There have been major publications in major journals such as the Journal of the American Medical Association, the British Medical Journal, that talk about sort of the ethical considerations of such trips. And then there are even other organizations that actively discourage participations in short-term trips. To quote one of the organizations, they basically said, experiences are being seen in a negative light, they're self-serving, they raise unmet expectations, there's minimal benefit, they're ineffective, inappropriate. In fact, one organization actually put together an online website that basically calls short-term trips the worst practices ever and uses anecdotes to describe all these terrible things that short-term trips do. And so I know everything that I've just outlined seems incredibly negative, right? And you may wonder why we've even gotten interested in the phenomenon, but this is where we came in as the 53rd week, in the sense that basically we agree that it's the placebo of global health. In their current form, short-term trips are pretty useless, right? That is not to say, though, that we are on the same calculus of people who feel that short-term opportunities are all bad. We believe that there are still some intangible benefits that come from being able to reach out to other people, the relationships that are built. Even if there's unmet expectations, there's still a relationship there. There's still a human connection that's made. And we also recognize that we live in societies that value a few things: charity, altruism, and autonomy. What that basically means is that people are interested in helping out. Canadians and Americans and people from the Western world grow up in a world where it's like, okay, I want to help, I want to make a difference, and we also value the autonomy to allow people to do what they want, in the sense that discouraging people is not necessarily going to make them not go. So we argue that if the issue here is the balance of the benefits, if the issue here is balance of benefits, is there a way we can improve these trips? Is there a way we can shift that balance of benefits through innovation, collaboration, research, to actually allow young people to still go abroad, but to do it in a way that actually benefits the community there as well, while retaining some of the benefits that they gain from going abroad. So in essence, we're saying, don't just ignore such trips or discount them because right now they're bad. Sure, they're bad, but instead of ignoring them, instead of telling people not to go on them, we should remember our societal values. We should remember that whether we like it or not, these trips are here to stay. So we should maybe try to find some ways to reduce the harms associated with these trips and maybe actually make them better and beneficial for the communities that they're purporting to serve.